Running an ambulatory practice today isn't simple. Leaders are balancing patient care, staffing pressures, financial performance, and rapidly changing technology all at once.
Welcome to In Practice, a podcast focused on the latest in ambulatory care, what works, and what leaders need to know to help their practices thrive. Hi, I'm Dr. Bob Murry, the Chief Medical Officer at NextGen Healthcare and a practicing family medicine doctor. This is In Practice, a podcast where health tech leaders, clinicians, and practice administrators discuss the challenges in ambulatory healthcare, the challenges that practices face every day, and strategies, practical things to help overcome those challenges. Today, I am joined by Dr. Dodji Modjinou. He's the founder and CEO of Advanced Rheumatology Associates of Nevada. And he runs an independent specialty practice at a time when consolidation and private equity and physicians wanting to be employed rather than run and own their own practices is really reshaping the landscape of healthcare. So Dr. Modjinou, welcome, and thank you so much for joining us.
Thank you, Dr. Murry. Thank you for having me.
Absolutely. So let's get a little background. Maybe just tell me a little bit more about your practice. Obviously, it's in Nevada. It's rheumatology. But how many physicians do you have? How long you've been open? What's kind of the story of things for you?
Yeah, so Advanced Rheumatology Associates of Nevada, we created this practice in 2023. My wife and I moved here to Las Vegas about 10 years ago, actually. And initially, I took a faculty position at UNLV School of Medicine. It used to be UNL, but switched to UNLV School of Medicine. So I was on faculty there for almost 2 years. And there was a time where at some point, I was the only rheumatologist on staff in terms of teaching and seeing patients. And so things got a little bit more tight schedule-wise, and I was about to get married, among other things. So position opened up with a company locally, a hospital-based employment, where I went to work for 5 years. And with corporate exposure and stuff, you start thinking, well, you know what? I may want to start doing my own thing. And quite frankly, having done my training in New York, NYU fellowship, and you come here, you just see the need. You see a need for great rheumatology that's, quite lacking, I would say. And so you start thinking, well, I want to have a little flexible schedule, but how can this be my contribution to my new community as well? So that's where the idea came from. And then we started seeing patients here in October 2023.
Okay, so you've obviously had quite a path towards owning and running and being an independent practice. So what are some of the biggest operational challenges that you think somebody trying to run their own practice is experiencing these days?
As you know, with the landscape of healthcare right now, it's just not the easiest thing to do. But I would say, at least in my case, what it has been first and foremost is the human capital, actually. Finding the right experienced staff or the staff that you can train well and retain with Las Vegas market is just a little bit challenging, but we currently have a pretty good team. But then when you talk about rheumatology, you're also dealing with the challenges of having to do a lot of prior authorizations for biologics, documentation, and this, among other things. So basically, it comes down to a lot of things taking our time away that we really have to fight a little bit to make sure we recapture that time so we can be efficient, obviously, and take care of our patients and keep productivity going as well. So,
yeah, I mean, it's for sure finding the right staff, administrative burdens, and then I think many physicians and providers think that administrative burden is increasing over time. That the way that we have to document things or do things in order to get paid for the care we deliver is getting more and more difficult. So, I mean, overall, what is your advice to someone who is either independent or wants to become independent? Like, how should they think about those challenges, and then what are some of the tools or techniques that they can use to overcome them?
First, you also want to see the needs of the community you're in, and the needs of your patients, obviously. But then once you decide on where you want to be and decide where you want to serve, it comes down to what type of support you need to get going. In terms of support, I would say in my case, I did get a consultant initially to help me, and the team was formed to make that happen. But I would highly recommend that people consider coaching, not in general, talking to people who have done it before. They say, hey, what have you done here and stuff like that. So coaching and mentorship, and asking for the necessary help to just get things going properly, and then tweak things from there on and on out. So
I think a lot of independent physicians, they think about like getting some help or some support from a physician network or support organization or an MSO. Or do you have any experience with those or any advice for folks that are maybe looking for expertise from outside organizations?
I have been very fortunate that in my case, what has happened was I reconnected with Ara Care, which it turns out I had a contact with the physician liaison with that company group a while back, and I actually forgot about it. We reconnected at a conference a few years back. And long story short, very fortunate in the sense that with Dr. Howard Bush back in Florida, about 2012 or so, started the ideas, you know what, let's get a team together. There's power in numbers, and a rising tide raises all ships. So he got a lot of rheumatologists together, and things took off. And the idea is let's team up, when it comes down to negotiation with insurance companies and whatnot. As things took off, then there was a creation of the band care aspect. So they are sister companies. And so with band care, what happens there is it's a lot of support. I mean, for patients, for example, if I were to schedule a patient for infusions, if I put the order in from A to Z, they help with the support prior authorization. And with that network, you have colleagues. There's a lot of collegiality. It's not like winner take all type of mentality. People I can call or email, contact any shape or form and get a lot of coaching. That also goes not just on the physician aspect, but the actual band care leadership from people like Andrew Rips all the way down. And so in that sense, what happens is I have, even though I'm N of one here in my practice, running the practice as a clinician, I have a strong team that's not on site, but backing everything else I'm doing. And in these challenging times for healthcare as a solo or independent practitioner, you need that kind of help. You need that kind of support. For example, I don't negotiate drug prices. They do that for me. Yes, I have to pay a fee, but it's worth it. It allows me to have a little more time for my patients and have a little time for me too. It's okay.
Yeah, no, it's great. I think, obviously, Ben Care is kind of specific to rheumatology, but it is one of the reasons why there are still many independent rheumatology practices out there. And the challenge is that different specialties do have different levels of availability of the things that are providing some of the services that it sounds like you're taking advantage of with that organization. As well as the collegiality and the community of, similarly minded folks. So it's great that you have that. Kind of as a solo business owner / physician, you're going to have to wear a lot of hats, right? You're the owner, you're the paymaster, you're the clinician, the administrator. How did you think about the infrastructure behind allowing you to play all those roles, and how do you actually organize some of the duties of the practice?
Yeah, well, obviously we also thank you for asking that question, by the way. We do have to tailor things to our own style. We all have different styles as to what we want, how we want to run it, and stuff like that. Some of the answers I would say I've touched on, the sense of being part of the group I've been very fortunate to be part of and stuff. But I would also say that as doctors, and as you can tell as yourself as a clinician, for better or worse, we are very independent-minded. And regrettably, a lot of us are not growth-minded folks. And so we want to start having growth mindset. instead of just say, hey, have a fixed mindset. I'm just a physician. I don't know anything about this and that. There has to be a point where you say, you know what, I don't know it, but I do want to learn it. And so for me, that really helped in the sense that I was willing to go learn from people who know, just like if someone came to me to see me as a rheumatologist, sure, I would say that I have some expertise that I can help people with. But I'm not, at the same time, I'm not a mechanic, but I can go learn that again to a great extent. So I'm giving you a long answer here, but it's all seeking the help we need and be willing to learn and grow.
Yeah, and I like that kind of twist on a growth mindset, right? It's growth in terms of not necessarily expanding your practice as fast as possible, but you yourself growing in terms of your knowledge and your skills and your capabilities in order to let that practice thrive.
That's right.
I like that.
That's right.
How do you think that healthcare technology has evolved, and do you think that it's making things easier for independent practices or harder?
I would say overall it's more easier. I would say, obviously, I'm not that old, but I can say that going through medical school 20 years ago, we used to do paper charts, and the physician can come and just write a line, or if you want to call it writing, and move on. And then you come and say, okay, so what was written here? Trying to decipher that. Those days are gone. Obviously, you can see the EHR. The advantages from just having dot phrases or, templates went from, artificial intelligence, helping us tremendously. So I think it's a good thing. We can, in the right setting, if you have integrated systems, you can also pull up data from another clinic or another study, a study the patient went to do. You can get that data because you get login. So in that sense, it's a win. It's a win. So I think it's a good thing.
Yeah. Are you using any AI in your practice?
I am. As a matter of fact, I'm very, very grateful for your own next gen ambient assist.
Good.
I am very, very grateful. I'm one of the early adopters of ambient assist in Ara Bend Care. So much so that right now I cannot do without it. I remember the first day I used it, too. First day I used to have a scribe, remote scribe. And the problem was that with that was, even though it was a good thing, at the end of the day, we will have to run the list and make sure things were heard right and stuff. And so now with ambient assist, I can just put my phone there and focus on the patient. Pay attention to the patient, pay attention to what they are telling me, give them the necessary time, listen to them. And it just really helps that at the end of the visit, within less than 30 seconds, I can have the main points of my notes summarized for me. I can always make a few tweaks here and there, but it just really, really has been a game changer for me. Another point I really like about the next gen mobile aspect of things is the fact that I can just take a picture and it instantaneously goes in the patient's chart. So just a lot of great things, a lot of great points.
That's great. Yeah. And of course, NextGen Ambient Assist is our AI scribe that's built into the provider app, NextGen Mobile. So let's maybe think about this from the patient side, right? Mm-hmm. Do you think that the care that's delivered at an independent practice is different than as part of a health system or as part of a big, in your specialty, a big private equity backed, rheumatology, group? How should patients think about the difference between those practices?
Well, for one thing, one of the key things I personally like about private practice is that when we need to implement changes, we don't need an act of Congress, so to speak, to make those changes. It's done instantaneously. I mean, if my staff brings something to me in due time and there's a decision to be made, I make the decision. If it's made to be made right there and then, I make it right then and then. We move on. And so it's very, very quote unquote nimble in that sense, and things can move faster. It also allows for us to assess what the patients need and make, to some extent, real-time changes. And you don't need a corporate structure that the request has to go all the way up the ladder, get approved, and trickle down to you in terms of decisions. So all of that, I like the private practice or independent aspect, practice of things.
No, you bring up some very good points, right? So because you're able to be more nimble and to make decisions to provide the care in the way that you want to, not necessarily needing to run that up the chain of command, so to speak. I think patients see that, right? They see that you're able to, direct things for them in the way that you think is best for them, and I'm sure that they feel that. A lot of physicians, they don't care as much about the business aspects of medicine, right? They just want to, see patients, right?
Mm-hmm.
But do you think that an independent practice actually allows them to do more of what they want to do? Or because, in a big group practice, right, you may have lots of other duties or lots of other things you got to do that you're not necessarily aligned with, right? Where do you think things fall in terms of the independent or the private practice being the vehicle where you can actually do what you want to do?
Well, thank you for asking that question. Absolutely. The problem is when you work for big corporations, a lot get put on your desk that doesn't have much to do with patient care, and and to some extent, depending on what corporation you're working for, you may not even have a say in what comes out of that. You just have to execute. And as you may know, I'm preaching to the choir, as they say here, where in some cases we have to report to people who have never touched patients, who just don't know anything about what we're doing, but we have to report to them. And so in that sense, I personally, again, like the independent aspect of things in the sense that we can tailor more toward patient care, less quote unquote fluff, more action, and just make sure that that's our primary goal. And we already have enough with the pharmacy benefit managers and all these people, prior authorizations, that we don't need to make it more difficult. We need to be more efficient. I believe that being in an independent practice allows us to make it more efficient the way we need to tailor to that community and our patients. So more so than a big corporations, I would say.
That's great. So here's a maybe a provocative question. There are definitely a lot of people out there that say the era of the independent private practice is over. That you're a dying breed, right? And that everyone will be employed or part of a big PE group or whatever. What do you say to those people?
I would say not necessarily. Not necessarily in the sense that, first of all, we were just talking about the corporate aspect of things. What if, depending on what specialty you're part of, the corporation says, you know what, we tell you what, we have enough AI, and I'll use AI prescribing to take over your job. And I know it's not far off. It's happening already in certain fields, as you know. So in that sense, I would say it's not, I wouldn't say that independent practice is completely gone, especially if you can find the right group of people, at least, or join, or maybe start the way on in the right way and not undertake too much, but join the right group where, again, there's power in numbers, there's a corporate structure, maybe physician-owned type of thing, that type of corporation that really helps you guys, physicians, so they can help you with the practice management of things, so we can then focus on patient care. And so in that sense, we can make it work and also leverage the new technologies we're talking about, artificial intelligence, and put it all in. And so we can then find a way to make it more doable and still give quality care while being good to our community, and also have a family life, which is not a bad thing to have.
I agree. Yeah. And yeah, I mean, from our perspective, we see the pendulum kind of swinging the other way, in certainly in some specialties more than others these days, but folks that had joined large groups or had, decided to become employed by the local healthcare system, they're now breaking away, restarting their own practices. It's a movement, back and forth.
Mm-hmm.
All right. Well, I mean, let's maybe just have one final question. What kind of one piece of advice would you give that you haven't already said for someone who's thinking, maybe I've always wanted to start my own practice, but I just don't know? Like, what would you say?
Well, thank you again. This is great. Just these questions to help our colleagues out. I hope they get one thing out of it. I would say first and foremost, just know that the beginning is not going to be necessarily easy. Nothing at the beginning is easy. And it can be easy to get discouraged when things are not going according to plan or stuff like that. So be willing to, again, learn from people who know what they are doing or who can guide you through it. Have that growth mindset that I mentioned, and be coachable. And above all, have the patience to go through it. Have the patience with yourself. Have the patience with people you're working with. Give it the necessary time. And it gets better. We'll be willing to, as John C. Maxwell will say, be willing to fail forward. And so I would say it's a lot of patience, but also know that it can be done. If it's been done before, it can be done again. You just have to have the right guidance doing that.
Yeah, no, that's great advice. Thank you. The only thing I tack onto that is watch your cash flow and make sure that you have a big line of credit, because it takes longer to hit black than you might realize.
Oh, that's very true too. That's absolutely true. So, I happened to get a line of credit at the beginning that quickly at some points I said, wow, I need to do better here. So no, your point is well taken. So that's definitely the financial aspect of things and cannot be understated. Otherwise, without if the staff is not getting paid, you will not see them, and things can go downhill quickly. So.
Exactly. All right. Well, Dr. Modjinou, thank you so much again for being part of the show. Great advice. Congratulations on your practice, and we wish you all the future success as you continue to enjoy it and to grow. And to all of our listeners, thank you for making time to join today's episode of In Practice. Be sure to subscribe on Apple Podcasts or Spotify so that you will never miss an episode. Until next time, thank you.